Hi everyone, Dr. Debbie from Pain Free and Fit. Today, a great tip for those of you with spondylolisthesis pain in the lower back. A walking tip from my new book, Walk Away Back Pain, on leg and hip alignment to help relieve your spondylolisthesis symptoms. Hope you enjoy. So if you've seen any of our other videos on the channel for spondylolisthesis, you know one of the recurring themes we're talking about is spondylolisthesis pain is aggravated by an anterior pelvic tilt, where the pubic bone is lower than the tailbone, because this increases the arch in the lower back, helps to drive that spondylolisthesis vertebra forward, and irritates the back structures of the spine, such as facet joints and compression of the posterior disc. So one of the things we never think about, though, is what causes this anterior pelvic tilt. And when you start looking at what people do and what spondylolisthesis sufferers do on a daily basis, you'll notice that many times their repetitive movements and their postures are what's actually driving that anterior pelvic tilt, especially during our most common daily full body activity, which is walking. Many people don't realize that as they walk, they're perpetuating anterior pelvic tilt posture and aggravating spondylolisthesis pain. By underutilizing the glutes, they tighten the hip flexors. By underutilizing the core or having sway back posture as they walk, they're compressing vertebrae, they're weakening core muscles so the spine can't become stable, allowing more slippage of the spondylolisthesis vertebra. And today's topic, they're walking with leg alignment problems where the feet and the legs are turning out. Now it turns out that when the feet are turned out more than 7 degrees, it creates an association of anterior pelvic tilt posture. If the legs are straighter, it helps to rebalance that pelvic tilt so it doesn't tilt as far forward. If we have a tendency to walk with one leg turned out more than another, that side will have a tendency to hip hike, meaning that the pelvis will come up. This is a very slight motion when you're walking, but you'll see it from behind. The leg that turns out will have a slight upward swing and lateral movement of the pelvis, which compresses that side of the lower back, jamming that facet joint, jamming that disc, irritating with stretch the opposite side of the lower back. Many times these are the small repetitive motions that we don't think about during the day that's leading to and aggravating our spondylolisthesis pain. So today's tip while we walk is trying to straighten the legs out a little bit so we reduce that amount of external rotation at the hip or toe out angle. Again, up to 7-degree angle, which is very slight, is allowed, but more than that is considered an abnormal or dysfunctional gait pattern, and many times that's leading to spondylolisthesis pain. When you think about straightening your foot, focus on it as you're bringing the leg forward from behind you during the gait cycle. When we walk, many times by the time the leg's out in front, it's too late. The leg has already turned from its rear position. So as you pull the leg forward from the back position, think of turning the thigh inwards just a little bit. Don't think about the foot. Let the foot react to what the thigh is doing because the correction is in the hip joint. And if you think about rolling or turning that thigh in to straighten out the kneecap, as if there's a flashlight on that kneecap and you want the beam to be straight ahead, that will help to align not only the thigh but the lower leg and reduce that tendency of external rotation and irritation to spondylolisthesis pain. If you like this video on leg alignment and spondylolisthesis walking, check out our channel. Subscribe to it. We've got a lot of great videos out there to help you with healing exercises for spondylolisthesis. Questions or comments, write in. As always, I'll do my best to answer them. If you'd like to help share this valuable information with others with me, give me a thumbs up below. And remember, our new book, Walk Away Back Pain, is a great source to build a walking program for yourself based on your unique postures, your unique mechanical dysfunctions. We identify 10 major steps of walking. Combining this with other stretches and exercises that are in the book, you can do a nice job in reducing your spondylolisthesis pain by self-rehabbing during an activity that you're doing during the day anyway without requiring extra rehab time. I hope this video on leg alignment and spondylolisthesis pain helps you with your walking and your chronic spondylolisthesis low back problems.